organization that's been in existence since 1859 nationally and 1913 locally. For us to put racism ahead of empowering women tells you how strongly we feel and how much we understand the dynamics of racism in America. So, May 25th, 2020, George Floyd needed the neck for all the world to see. And from that point on, everyone made proclamations of what we were going to do different, how this country was going to change, what we were going to do. I am proud to say that the YWCA approached the cities of Elyria, cities of Lorain, city of Oberlin, and asked their councils to pass resolutions declaring racism as a public health crisis. Happily, they all did that. But in doing that, we understood that those documents were just going to be empty, sitting on the shelf, getting dusty, unless there was an organization to stand in the gap. And that's where the YWCA comes in. We have had We've had a history of racial justice, like I said, here in Elyria since 1913. So the plan that we have been working on for the past, now it's 20 months, is a plan to create a racial equity center. You know, we've got some other crises going on in this community, whether it's the opioid problem, mental health problem, climate control, climate crisis. But the difference in that and racism, systemic racism. I should have been clear about that. I'm not talking about individual slights of someone calling you the N-word or not being treated fairly, African Americans not being fairly in shops, when you're shopping, or in restaurants. Those are the microaggressions. I'm talking about systemic racism that can be changed by policy, that was created by policy decisions and can be changed by policy decisions. So when we talk about racism, I might interchange that, but what I'm talking about is systemic racism. So the YWCA for the past 20 months have met with key leaders in our community because in the rest of the community, when you look at the opioid crisis or the mental health crisis or climate control, whatever it is, there's organizations that are dedicated to seeing what the policies and the practices are and making sure they're moving forward, that they're living up to their pledges, their promises. We understood that unless the YWCA stepped into that gap to help the cities, to help organizations, to live through their proclamation, their declarations that they made on May 25th, 2020. I can remember seeing on Facebook a lot of folks saying, oh, I'm so glad that we don't have those problems here in Lorain County that they have in New York and Washington. And right now I'm seeing the body language. The black folks in the room are shaking their heads like, yeah, we don't have those problems here in Lorain County. Because we know we do. We know that historically we have these problems, but historically we haven't had any organization that has been dedicated to looking at the problem. So, quickly, 20 months we have created what is known as the Lorain County Racial Equity Agenda. You can pick up a summary of the agenda out in the lobby. That's what this is. The document itself is a 51-page document. It looks at health, basically looks at these social determinants up here, but it's health, housing, criminal justice, education, economic development, and we added history. We added history because, as you found out from hearing Ethan's presentation, which we worked with Ethan, and we're very excited that finally someone is picking up the mantle of looking at the history of African Americans in this community. We added history because we have to change the negative narrative that exists out there about black people, black and brown people. And again, I'm not trying to slight any other races, but it is about African Americans. I don't have time to give that talk, but one of the things our center is going to do, is, well, what we're doing actually, along with our co-chair of this effort, Cindy Andrews from the Community Foundation, we're making it possible that people can go through racial equity training, because we all need to talk the same language. First of all, we need to start talking to each other, right? Having honest conversations with each other. And this is such a hard topic. So we need to figure out ways that we can come together and do that. So we know that we can't change people's hearts and minds, because a lot of this is just ingrained in the way that we were brought up. We didn't even know that we were being brought up, and I'm talking black and white. We were all brought up breathing the same air, drinking the same water. And so we have these negative images, or we have these perceptions of what people are. And so we have to unlearn that sort of thing. So we can't change the hearts and minds, but what we can change are the laws and the practices. So I'm happy to say that we've got allies, Mark and, well, I don't name them all, but Tom Dawkins, who's in the room. Tom is the executive director of the Honor Center at Oberlin College. Oberlin College is creating a racial equity center. This is serious work, and we need allies, and that's what else is in the lobby. You can sign a memorandum of understanding that says that you want to be partners and allies with us to do this work, because it's going to take all of us to do it. It took all of us to get into it, and even though we say racism is a public health crisis, it's not something that the health department can get us out of, or the health industry can get us out of, because we're talking about housing, education, economic development, and racism goes across all of those. Systemic racism, the policies and practices go across all of those things. Thank you.
Thank you, Ms. Allison. The next guest that we have is a representation from the Elyria Police Department. And you say, wow, we're talking about health and then law enforcement. And part of this is a dynamic understanding that we're not looking to try to get out of this crisis through enforcement. And we believe, and there's a lot of writing, there's a lot of research around violence as a public health crisis, as a public health epidemic. I work very closely in my job as Assistant Safety Service Director with the Elyria Police Department. And it's a great pleasure to work with these men and women. They provide a great service to our community. And we challenge ourselves and we struggle with this piece. So Lieutenant Welch is here. He's going to share some information around this dynamic problem that we have. And we're searching for solutions, but it is not something that we can arrest our way out of. So please share with us some perspective that you have. And then we'll get further into how we identify violence, community violence as a public health crisis. And we'll have some of our health folks share with us how that ideology works. So please, sir.
Thank you. Excuse me. First of all, again, my name is Jim Welch. I'm a lieutenant with the Elyria Police Department. I've been with Elyria PD for over 24 years. Currently, I'm one of 3 shift commanders in the patrol division. I'm in charge of the afternoon shift. So I would like to thank Mayor Whitfield and Director Williams for inviting me here today to talk with you. And I would like to thank you as well for showing up, taking time out of your day to provide your input and be part of the solution to some of these topics. You know, essentially the police get paid to provide full-time duties, of which it's incumbent on every person in the community to do as well in the interest of public safety and security for citizens. Essentially what that means is we need to work together. The police department can't do this alone. We need your help. We need your tips to curb violence and solve crime. I just wanted to share with you a few stats, kind of put this all in perspective. So right now the Elyria Police Department has 85 sworn officers. We made over 2,300 arrests last year, issued 2,600 citations, and we seized 222 guns off the street just in 2022, but yet we still had 9 homicides. So our officers are working tirelessly to reduce crime and reduce gun violence especially, but it's not enough. We need to do more. And you know, I did some research just to kind of prepare for today, and one of the things that kind of struck me is that in 2020, the leading cause of death amongst children was car crashes. That's been replaced with gun violence. Since 2021, the leading cause of death amongst children is gun violence. We have over 50 people are being murdered a day in the United States, and another 1,100 are being threatened with the use of guns. So it is a huge problem, and it can be attributed to public health. And I guess to kind of understand how that would happen, you kind of got to look at the definition of what public health is, and it's the act of preventing disease and prolonging life and promoting health through organized efforts and informing society of choices. And gun violence behaves like a disease. It's infectious. It can be passed on from person to person. It's contagious. And to solve it, again, we need to work together. But we need to start studying data on gun violence and the factors and the way to prevent it. It's really a problem in this community, and the police, again, do everything we can to prevent it, to solve crimes when it happens. But we need help, and it starts at home. It starts with parents and the way they discipline their children. You just can't say anymore that it's okay to act this way. There has to be some consequences for poor behavior, and it starts at home. Then it goes into the schools. We need help from the administrators of the schools. We need to change policy and laws to prevent gun violence, and once it happens, to incarcerate repeat offenders. Again, making arrest may not solve the problem, but when we have a repeated issue where somebody's committing these crimes time and time again, then there needs to be a stricter punishment for that. And there's a lot of reduction now with gun laws and lapse in gun laws with criminal justice reform. So that needs to change a little bit. But again, just to kind of sum it up, the police can't do this alone. We really need the help of everybody in society to help us to decrease violence, solve crimes, and hold those responsible for when they commit crimes. And it's not just a criminal justice issue. Again, it can be attributed to public health. We have to look at the various causes of it, whether that be mental illness, substance abuse, those type of things, and gather facts and data, and not just oversaturate areas and make arrests. We need to come up with outside of the box solutions to kind of curb this violence and reduce crime.
And so what we'll do is we're going to get into a little bit of discussion and some questions from you all, ask questions from panelists. But on this violence piece, and so you heard the lieutenant talk about what the role of law enforcement is. And as you hear, the law enforcement role occurs somewhere down the line. When we look at the public health dynamic of this, that happens earlier. Those are earlier interventions. Those are things that we have to change about the atmosphere, the environment in which we're raising our families in. And so what I would like, and I would like for the public health folks, the health experts, to try and correlate something for us. As we talk about public health, and we just came out of a major public health crisis, which many of us had never thought about a public health epidemic, the pandemic, because we had never been submerged in one. But this crossed all racial barriers. It crossed all socioeconomic barriers. It impacted everyone. As we see violence, We also saw that, and I think Ms. Donaldson will highlight, though it impacted everyone, there was still great disparity. Even within a pandemic that impacted everyone, disproportionately, consistently, it impacted a certain demographic way more than others. And we see this the same thing with infant mortality, regardless of whether they graduated from college for the mom, regardless of the socioeconomic status of the mom. So can you just kind of share how this, be it violence, and I think Ms. Donaldson chimed in on racism, but that whole health piece, and kind of correlate these things so we can see how they fit in together?
Well, I'll make this brief, and then you can talk more broader. But Ms. Donaldson mentioned, systemic. Janine mentioned systemic racism, and honestly, I think that the 400 years of slavery, be it whatever, has created perhaps physiological differences. That the trauma, has led to a more at-risk population when it comes to many of these health outcomes and the health disparities. And it's going to take a lot of effort, as Janine pointed out, to really address all of that when it comes to things like chronic disease. And again, it goes back to the social determinants. Food, healthy food, the food deserts that Commissioner Adams mentioned. If you can only go to Dollar General to get food, you're not going to get healthy food. And if you can't afford, let's face it, much healthy food is expensive. And so between the underlying physiology, the microaggressions, the trauma, whatever has been passed on over generation after generation after generation, I truly believe that's a big part of why we see the health disparities that we see. I am optimistic in that we are recognizing racism as a public health crisis. Our Joint Commission, which is one of our major accrediting agencies, has really issued now, it is a patient safety indicator looking at the disparities. And so we're pushing ourselves, our CEO of the Cleveland Clinic has addressed it as well and has made the statement that racism is a public health crisis. We are committed to looking at, doing the best we can to understand where we stand today in measuring those outcomes, to understand who is most impacted, and then trying to address that. Again, it's going to take all of us, everyone, everywhere. It can't just be the health agencies, but I think we need to understand how to provide better access, how to provide better nutrition, how to work with everyone else in the community that's here, all the stakeholders that's here to elevate. When it comes to gun violence, I can turn that over to Commissioner Adams, but I think that in general, the key point that you made was we need to start at very, very young ages. We have a captive audience in schools, which is great, but when we look at kindergarten readiness, there's disparities. I would guess, I don't know how well we measure it, but it starts even at birth, which is where, again, infant mortality starts. So starting at young ages, but surrounding those children with the wraparound services that they need to find a better solution, a better path, behavior modification when it comes to even suicide and drugs and alcohol and violence.
And as Mark is ready to comment, can you all be thinking of certain specific public health policies that exist currently that you think may contribute to where we are, so the disparities? There are a lot of policies that I know when I was on the Board of Mental Health, we would review some of our own policies, and we would see how maybe unintentionally these, not only do we create, but we sustain some of these chronic conditions. So,
well, sure. Actually, I could.
Are you going to address the gun violence?
I can. Yeah, I can. I was going to do that one. Yeah, it's so the when I think about the communities that I'm serving and looking at various communities and anybody that's in front of me, I try to tell the staff this. I have it in a leadership slide that they see every single month when I meet with them, is to remember to place yourself in the shoes of the people that are in front of you. And whether they're an employee or whether they're a citizen walking in, always remember that, because you're making an assumption you know where they came from with the way that you're treating them, or that, how whatever, to make sure that to take all that into account. So when I'm talking with anybody, I'm trying to, and especially when I was going around Canton, and what I'm doing here in Elyria and Lorain, if I'm walking and talking with anybody, I'm always coming from, I have to, always reminding myself, I can't imagine, this is why the suicide rate is so much higher in services. You've got folks that are locked away. When it comes to being in the service, you've committed to something. You've got a lot of freedoms are taken away. You're being ordered to go somewhere. You have to do whatever it is that anybody tells you. You're kind of locked away. I mean, you still have some freedoms, but I mean, you're just kind of locked away. You don't get to do whatever it is that you want to do. And then I start thinking of some of the neighborhoods. I didn't have to worry about a grocery store down the street. I didn't have to worry about having access to getting to a school. I didn't have to worry about those things. And because you're not sitting there with that fear that, when it comes to mental health in that aspect is not as greatly as affected as growing up in a neighborhood where you don't have access to those things. And you have fear of where I'm going to get my next meal. You have fear. Now you've got, maybe you do something that's small you go to take something at a grocery store and you get hit, you get pinched, and automatically then you get a charge that's on you, and now you're 16 years old or you're 17 years old. And it starts in that process where instead of it being any type of diversion, it starts there, and then now you catch maybe at 18 or 19, you catch a felony for something that you did, but there is no diversion process there. That is a life then at that point becomes ruined. And it just, unfortunately, what happens is it's society against that child. And it's for a long time, then acting out, then violence. And it continues to get more violent, and it gets violent every single year, and the violence keeps going up, just as the lieutenant had mentioned when it comes to gun violence. So when he mentioned that, when he read the definition of what public health does, I was floored that you mentioned it. I loved that you mentioned that. And I was almost going to ask you the public health piece is how do we prevent that from happening? And it's something that I've talked with the staff about, but I hadn't made public that we've been talking about it. Because you haven't had a health department come out there and go, the health department wants to be involved in gun violence. You just haven't had that. And it's something that I was asked not too long ago, and about 6 or 7 months ago, that do I want to be involved in that? Yes, I want to be involved in that because the health department is the prevention piece. So we've hired 2 more epidemiologists. The second one starts in February. The goal was, when we look at this community health assessment, it's 3 years later, meaning that we look at the data from 3 years prior. That doesn't solve anything. It doesn't fix anything in the immediate. The reason we hired the epidemiologists is so that we can start mapping everything weekly and figure out where is violence happening weekly. Where is, if the SUDs, when somebody's overdosing, where does that happen weekly? Well, I want to know where it happened tomorrow or where it happened yesterday so that we can get out there and take people into the field and start talking to people. If there's any way, I mean, what do they do with us in the service? They go in, they grab you, they say, you've got somebody to talk to try to stem from any type of bad behavior or behavior that may hurt yourself or hurt others. We're not really doing that in the other communities. We might offer, but we're not tying it in. We're not making it as readily available. So if we can help the police department out in any way, or even the public, and having these extra, or in the hospitals, or anybody, and having these extra epidemiologists to look at every bit of data and say, from this data that's happened in just this last week, we know where maybe something might happen. Let's go reach those kids. Let's go talk to them. Let's go to the school. I had a conversation with the JVS on Friday. It'll be the first time that the health department's been in school in 10 years. And we're going to be in the school. We're going to start there. But if I can get in the other schools, we're going to get in those schools to talk with kids. But I'm trying to tone it down a little bit because I start getting into it. And I don't want to get too on, but there is a way that we can control that piece. And I've seen a program work without violence, and I've seen it even though Canton was one of the most dangerous top 10 cities, small cities in the United States. But I've seen it work, and it can.
2 pieces. First, Ms. Allison's got a comment, and then I'll hear your question.
So we talked about we can't arrest our way out of it, and that you need help from the community. We have to start younger. but we also have to think differently, think out of the box, and also look through now a racial justice lens. So my lens says to me, what are the laws about gun violence? Why do we have so many guns that are available in these people's homes? So that's a whole nother conversation. And I just want to acknowledge that we've got Moms Demand Action in the room with us. And if you want to talk about gun laws and how they have a disparate impact on communities of color. But that's kind of how we have to start looking at things, just through a lens, because we've looked at it through a lens before, but we didn't know about it. We didn't know that we were looking through what they call a normative lens of what middle America thinks. And so that's how we all look at stuff now. But that hasn't always been good for everybody in the country.
Okay. Thank you. My kids are, getting antsy, so I want to make sure I make my comment. I was born in Elyria and raised, basically, and I'm trying to find my place in Elyria to figure out how to help, And I've worked for the health department. I've worked for the Nord Center now. And my family have overdosed and died here. There's people, all kinds of, violence out there that's going on within my family too. So I'm the person that they look for resources. One of the things I wanted to mention that people might not know is that the police have started coming with the Nord Center and riding with us. There is feedback from the Nord employees though that I wish that they would take. And that to bring in the communication a little bit more. A few other things that I wanted to mention too is that I get sad when I don't see mental health more involved, because although you guys, it's a public health and prevention, there's so much trauma out there that that individual isn't even reaching out to the Nord Center. People are seeing my face and they're coming to me, but I'm trying to let them know there's no Superman out there either to come save anybody. But my best friend, who is African American, is against the vaccine, and she's going to be a nurse, and here I am, a white Caucasian lady going for public health, but I know all about this stuff. Why do we go to the same school? Why does she not know? It's more of a trust. But why is it shit building at the educational level when you're trying to get a bachelor's degree? So I just kind of wanted to mention those things, and even bringing in the communication with the community. So I appreciate, Frank has really had, I went to school with Frank, so I know his passion when it comes to this stuff. But pulling people out, there's so many people stuck inside, they don't think they can reach to these resources. So I would ask that those programs be brought in to kind of pull those people. The YMCA, the word you used, gap, I appreciated that, because that's what I've been seeing